Chapter 20, Vascular Physiology, Screencast 2. The topic of this screencast will be local flow. Now, when we talk about local flow, the thing that we have to keep in mind here is the fact that not all capillaries are filled or perfused simultaneously, and that local flow will vary. And one of the primary determinants of flow will be metabolic demand. But the first thing that we're going to talk about is degree of vascularity, the myogenic response, local regulatory factors that may alter blood flow, and then total blood flow. Now, when we talk about flow, really what we're looking at is milliliters per minute, and that is what is actually going to the tissue. And the thing to keep in mind here is flow really has to be high enough so that perfusion can be maintained to any particular tissue. Now, the first thing that we're going to look at is the degree of vascularization. And what this really means is the extent of the vessels in a particular tissue. Now, for example, if we look at tissues that are highly metabolic, so tissues such as the brain, skeletal muscle, heart, liver, these are going to be tissues that have high vascularity or a really good blood supply. Other structures, such as tendons, ligaments, epithelia, cartilage, they're not going to have very little vascular, so are considered to be avascular. Now, angiogenesis, think about genesis. So this is a term that's referring to the fact that we have the capacity to form new vessels. Now, this is a process that takes time, and it will happen over weeks or months, and the point here is to increase perfusion to a particular area. Probably the best example is an adaptation in skeletal muscle to endurance training. One of the things that happens is you'll actually see an increase in the capillaries in the muscle that was trained. If we look at adipose tissue, individuals that gain weight, you have to actually have vessels that are going to perfuse that tissue. So we will get new vessels. If we look at coronary vessels, so this is a really interesting one. So quite often, the body will determine that it has a blockage, and in an effort to bypass that blockage, we actually see the growth of new vessels. So it's kind of the body's way of doing a bypass. Now, this also leads to the fact that we have what we're going to refer to as a use or lose principle. And so here, this is about regression. So generally what will happen is a return to the previous state of blood vessels. So for example, if you have an individual that is no longer exercising, we're actually going to see a decline in the capillarization that was formed due to endurance training. If we look at weight loss and the adipose tissue is gone, we're also going to see this process of regression take place. Now, here is a really interesting concept, and what they're talking about here is angiogenesis in a tumor. Now, keep in mind, cancer cells are alive, and they actually are going to require oxygen and nutrients and all of that to stimulate growth. So what will happen here basically is these tumors are going to send these signaling molecules and basically result in the growth of vessels into that tumor. And so that can be a problem with these growth factors. One of the things that's happening here, or a current avenue of research, is looking for a way to stop this angiogenesis and starve the tumor from blood supply by making sure that it's not developing these new vessels that are going to meet the demand of the growing tumor. Now, another way that we're going to look at the determination of local flow is going to be what we refer to as myogenic response. This is due to smooth muscle in the vessel wall, and it's going to keep local flow relatively constant. So keep in mind, this goes back to the fact that flow in capillaries and veins is constant. It is not pulsatile as it is in the arteries. Now, this is not an intuitive adaptation, so let's kind of walk through this. If systemic blood pressure or driving force rises, this is going to result in more blood entering an arteriole, and it's going to stretch. This larger driving force is going to result in increased flow if nothing happens. So basically, the response of the smooth muscle of the arteriole is going to contract. By contracting, it's going to increase resistance, and this will return local flow to original levels. Now, the opposite is going to happen when we see a decrease in blood pressure, and there is a decrease in the amount of blood. There's going to be less stretch. In response to the decrease in stretch, the smooth muscle of vessels will actually relax. This basically decreases resistance and makes it easier for blood to flow. So we look at relaxation of the vessel while returning flow back to original levels. So this is what we mean by myogenic response. So it's the smooth muscle responding to changes in pressure, but the goal here is to basically maintain a constant flow. Now, when we look at things that are going to have an impact on local flow, one of the biggest things is going to be metabolic activity, or when tissue is damaged. So before we go there, we have to look at some factors that are going to be released. They can be released by the tissue, they can be released by vessels, and what we're going to refer to them as vasoactive. So these are chemicals that somehow are going to change blood flow. Vasodilators, they are going to dilate arterioles, relax precapillary sphincters, and basically going to increase flow locally into those capillary beds. Vasoconstrictors, on the other hand, are going to constrict the arterioles and contract the precapillary sphincters. So this will actually decrease flow into those capillary beds and decrease perfusion of that tissue. Now, one of the things that the body really tries to do is autoregulation during metabolic activity. So this is the process by which tissues will actually control blood flow. When the activity level of a tissue increases, there are going to be a number of stimuli and signals that indicate that there is inadequate perfusion and actually act as vasodilators. So if we start to see a decline in oxygen or nutrient levels, this is going to result in vasodilation. If we look at carbon dioxide, lactic acid, hydrogen ion, potassium levels increase, that will also act as a vasodilator. Now, one thing that we have to keep in mind here is when we look at negative feedback. So as perfusion increases, vessels will eventually constrict in response. Now, one example is reactive hyperemia. What this is basically is an increase in blood flow after it is temporarily disrupted. Here we're looking at additional blood flow is required to resupply an area that was not getting the blood that was necessary. An example of this would be entering a warm room after being in the cold. A much more simpler way to see this, press on your nail beds. When you press on your nail beds, you'll actually see the pressure, okay? And as soon as you release that fingernail, you'll notice that the color changes. So there is local increase in flow to that particular area to make up for the amount of time where it did not receive any blood. Another example is, imagine someone is taking your blood pressure. They increase the pressure within the cuff and it's really tight. So basically downstream from the cuff, that area is not getting any flow. Once you release the pressure within the cuff, there is going to be an increased flow in that area to make up for the time in which blood flow was interrupted by the constriction of the blood pressure cuff. Now, we can also see a change in flow due to the inflammatory response. When we look at tissues that are damaged, a number of things are going to result in the release of vasoactive chemicals. It could be damaged tissue, platelets, etc. And what's going to happen here is we're going to see histamine and bradykinin. These are going to be released and they're going to result in arterioles dilating. We also will see histamine changing capillary permeability. So keep in mind, these are substances that are going to be released in response to trauma. It could be exercise. It could be an infection. It could be an allergic response. Another thing that might also be released is nitric oxide, and this is a rather potent vasodilator. Now, tissue damage can also result in the release of vasoconstrictors. And this makes sense if we're looking to help prevent the blood loss through damaged vessels. Examples of these vasoconstrictors would be leukotrienes and thromboxanes. These are actually eicosanoids that we've talked about previously, and we know that they act as local chemical messengers. Now, this particular diagram here is really talking about different substances and are they vasodilators or vasoconstrictors. Now, the first thing that we're going to look at, local substances. So things that are going to result in vasodilation include a decrease in oxygen levels, a decrease in nutrient levels. So imagine lower levels of glucose or something along those lines. An increase in carbon dioxide. That's an indicator of greater metabolic demand and more waste is being produced. Production or increased levels of hydrogen ion, lactic acid, potassium. If we look at histamine, bradykinin, nitric oxide, and prostaglandins, these are all local substances that are going to result in vasodilation. Now, when we look at vasoconstriction, if we look at those vasodilators, it's going to be the opposite. So if we look at increased oxygen levels, increased nutrient levels, a drop in CO2, hydrogen ion, potassium, or lactic acid, leukotrienes, thromboxanes, endothelins, these are all going to result in vasoconstriction. Now, there are also hormones and neurotransmitters which will act as vasodilators and vasoconstrictors. When we look at vasodilators, we're going to look at atrial natriuretic peptide, ANP. This is going to be an important hormone that we're going to talk about later. It is the only hormone that comes into play when there is an increase in blood pressure. Now, we're also going to look at epinephrine, and so remember that's going to bind to beta-2 receptors within coronary arteries and skeletal muscle and result in vasodilation. Now, when we look at angiotensin II, aldosterone, and ADH, those are going to be vasoconstrictors. Now, to a lesser degree, norepinephrine and epinephrine, when they bind to alpha-1 receptors, can actually result in vasoconstriction also. Now, what we have to keep in mind here is there is a direct relationship with local and total blood flow. Total flow is the amount of blood transported through vessels per unit of time. There's our cardiac output. And remember, we talked about this in the previous chapter, and it's about 5 liters per minute at rest. This can increase significantly with exercise. So if it increases, we're actually going to look at an increase in the availability of blood to tissue. So we increase total flow. We're probably also going to see an increase in local flow. Now, total flow is going to be regulated on both in relationship between the heart and our vessels.